Welcome to County Portal, your simple source for local government services and public records. Let's get started.
So, you need to go to the health department, but you're wondering, can you just walk in? This is a super common question. Maybe you need an STD test, a flu shot, or some other health service, and making an appointment feels like a hassle or isn't possible for you right now. The short answer is, it really depends. There isn't a single yes or no that applies to every health department across the country. It all comes down to two main things: the specific service you need and the policies of your local health department. Let's break it down. First, the type of service is the biggest factor. Some services are very often available on a walk-in basis because they're designed for quick, confidential, and easy access. These typically include things like STD and HIV testing, picking up free condoms, getting emergency contraception, or accessing naloxone, also known as Narcan. Many health departments have dedicated sexual health or harm reduction clinics that welcome walk-ins for these specific needs. Basic immunizations, like a tetanus shot or a flu shot during flu season, might also be available without an appointment, especially during special clinic events. However, for more involved services, you will almost certainly need to schedule a visit. This includes things like applying for the WIC program, which involves a lot of paperwork and an eligibility interview. It also applies to services like dental care, prenatal checkups, well-child visits, or getting travel vaccines. These all require a dedicated block of time with a specific healthcare provider, so appointments are necessary. The second major factor is your specific local health department itself. Remember, public health departments are usually run at the county or city level, and they all have different rules, staffing levels, and budgets. A large urban health department in a place like Chicago or Los Angeles might have multiple clinics, with some dedicated entirely to walk-in services. A smaller, rural health department might have very limited staff and hours, making appointments essential for them to manage their workflow. Their policies can also change based on public health situations, like we all saw during the pandemic when many places switched to appointment only to manage crowds. So, how can you find out for sure and avoid a wasted trip? The absolute best way is to check their official website before you go. Look for a page called Services, Clinic Hours, or Appointments. It will almost always tell you if a service is by appointment only or if walk-ins are welcome. If you can't find the information online, the next best step is the most direct one: just pick up the phone and call them. It's a simple, quick way to get a clear answer. Be ready to ask, I need name of service. Are you accepting walk-ins for that today? If you do find a clinic that accepts walk-ins, be prepared to wait. Bring a book, make sure your phone is charged, and pack your patience. Also, it's a good idea to bring your photo ID and any insurance card you have, even if the service is free. It's always better to be over-prepared. The bottom line is to always check first. A quick website visit or a 2-minute phone call can save you a ton of time and frustration. Thanks so much for watching. If this video helped clear things up for you, please hit that like button and consider subscribing to the channel for more straightforward health information. Leave a comment below if you have any other questions.